Menopause is the condition in a woman's life when there is steady decline in the hormonal functions, as a result of which there is complete cessation of a period. Usually in India it happens around the age of 51 years. So after menopause, that is after the period has stopped for a full 1 year, if there is any bleeding, then it is called post-menopausal bleeding. Post-menopausal bleeding is a clinical entity which should not be taken lightly, because amongst all the other causes, endometrial cancers are the most worrisome, and that is something that needs to be evaluated. I am Dr. Suman Singh, Senior Gynecologist at BirthRight, Rainbow Hospital, Bannerghatta Road, Bangalore, and I want to discuss about what are the common causes of postmenopausal bleeding so that you have your information in hand. Amongst the various causes, we have the most commonest cause as atrophic vaginitis, wherein there is thinning of the lining of the vagina because of the decline in the estrogen hormone, and this can cause spots or it can cause bleeding. There can be endometrial polyps, which are growths in the lower part of the uterus, that is the cervix, or it can be even polyps inside the lining of the uterus. It can be endometrial hyperplasias, where there is thickening of the lining of the uterus. Endometrial hyperplasias with atypical changes or nuclear changes can also be precancerous. That means they can lead on to becoming endometrial cancers. Endometrial cancers, like I mentioned before, can be seen in almost 10% of the cases, and this is something that we should not miss. Other causes could be improper use of hormones. Some women are on HRTs, that is a hormone replacement therapy, and if they don't take the medications properly, again they can have irregular spotting or bleeding. Some women have cervical cancers. So overall, postmenopausal bleeding is a condition that needs proper evaluation. What do? We would recommend an ultrasound, especially to see the thickness of the lining of the uterus. Any thickness which is more than 4 millimeters needs to be evaluated. We will also have to do an internal check for the woman to see if she has any local causes like cervical causes or polyps or growths. And of course, if required, we need to also do an endometrial biopsy. So this endometrial biopsy can be done as an outpatient procedure. We use what is called as a pipple cannula, which we can put inside the uterus and take a bit of the tissue, send it for testing, and see if there is any worrisome condition that is causing postmenopausal bleeding. So overall, postmenopausal bleeding is a separate clinical entity, cannot be taken lightly, it must be evaluated so that cancers are not missed. Thank you.